And so I think at the beginning there were a number of dedicated people. I mean, Alice Wolf and Frank Duhay from the City Council were the first people to pull the AIDS task force together. And they heard about the AIDS epidemic through a Conference of Mayors meeting, where they were told this is something you need to pay attention to. Then Dr. David Bohr and Dr. Paul Epstein, who at the time both were working at the Cambridge Hospital, were starting to see people with HIV infection. And they were like, well, we don't have any services for these people, and people are going to be needing services. And people were just at that stage of figuring out, well, what do we need? What do we need to do? There were really people from all different parts of the community. Christina Snyder from hospice, and people really, a large group of people who had a lot of ideas and energy and know-how, saying, well, we really need to do something. And Dr. Chalfin was the Commissioner of Health and Hospitals at the time, and he was great. He basically said, you know, well, we need to do something about it, and whatever you think we need to do, let's do it. So there was a lot of support from the top.
After a while, it became apparent that this was an epidemic. And it seemed as if the number of patients that Cambridge Hospital would have to deal with was increasing at a rate that was much faster than our ability to respond to an epidemic. And I had a personal experience of going to a patient's home and being with him when he died, and then having to spend a couple hours on the telephone calling funeral homes to see if I could find a funeral home who would take his body. So we put an ad in the paper. The auditorium was packed, and we started a complicated conversation. And I was primarily interested in clinical services, but the people in attendance were interested in the whole gamut of problems. And we would have conversations about cases, and most of the conversations were not about the medical problems, but were about the social service needs that they had. And after a number of meetings, the task force prioritized housing as the number one problem, and the people sitting around that table got larger and larger. There were social workers eventually, and psychologists, and psychiatrists, and outreach workers, and
you've always had people who are living with HIV involved in both the board and the planning and the organization on all different levels. So I think we've had a variety of perspectives represented at the table, always, and we always worked hard to make sure that we did that. Worked on the safety net programs and having sort of self-help groups for women to talk about ways that they could protect themselves. And we had the condom vending machine ordinance, which was mainly an educational tool, which we used to get people talking about how we need to have condoms made available to people in a lot of different places. We first got condom vending machines available in all of the restaurants and public facilities in Cambridge. We made sure that the informational stickers were in 4 different languages, representing the major languages spoken in Cambridge. English, Spanish, Portuguese, and Haitian Creole. I remember on one of the AIDS walks, my daughters were pretty young, and they always came with me on the walk, but I remember one year that there were people, protesters at the end, you know, with signs that said, you know, this AIDS is God's punishment against gay people and stuff like that.
Cambridge Cares About AIDS has been extremely successful just by nature of the good work and hard work that they have done. While Cambridge is a liberal city, there's not always agreement on causes, and I can remember very back early days the needle exchange program was not as well received as perhaps some people think, and yet Cambridge Cares About AIDS had the integrity of its reputation to be take a significant role in the implementation of that program.
Transgender women face discrimination, violence, and health disparities. They have very high rates of HIV, but there also exists significant individual, interpersonal, and community-level protective factors. The Transcend program promotes those protective factors to counter negative internal and external beliefs about being transgender and to develop HIV prevention interventions that focus on building self-efficacy. At Youth on Fire, the marginalized, the runaway, and the throwaway youth have the opportunity to leverage the support they receive into artistic and leadership development to their own benefit and that of other disenfranchised young people and the entire community. The drop-in spot was established through client initiative to provide a warm place off the streets, food, community, and referrals to Cambridge Care's clients living with HIV/AIDS. Peer leaders are paid staff who have shared some of the same challenges that clients face with health issues, addiction, trauma, and mental illness.
This wintry morning, she's teaching a 34-year-old woman named Alyssa how to rescue her friends from a fatal overdose.
Advocacy has long been a part of Cambridge Care's mission, and it takes many forms. Stories on the radio, newspaper editorials, community events, supporting participants to speak with the authority of their own experience, and sharing our expertise to improve the quality of care in our community. Our efforts call attention to the many complex and overlapping issues that affect the lives of people living with and at risk for HIV and AIDS. Cambridge Care's advocacy includes policy efforts as well. In 2007, Cambridge Cares publicly thanked the Cambridge Police Department for their steady support of needle exchange. Over the last 20 years, much has changed in the medical realities of HIV and AIDS. Demographics have changed too. But the intersection of social and economic inequality with HIV and AIDS remains. And so does Cambridge Care's commitment to address this epidemic with harm reduction programming, to reduce barriers and support change, to help people meet the goals they have identified for themselves.